Welcome to our second section of medical imaging anatomy course. Our second section is the imaging anatomy of head and neck. In this section we will discuss the calvarium and skull base, the paranasal sinuses, the skeleton of the face, the orbit and its internal contents, the ear, the arteries that supplies the blood to the head and neck, and the veins that drain the venous blood, the tongue and oral cavity, the lymph node groups, the larynx and pharynx, the thyroid and parathyroid gland, and the salivary glands. So let's start with the skull. This illustration here shows how our skull is made up. Here we have the brain case, or what is called the calvarium, which is the skull that covers and protects and contains our brain. And here we have the facial skeleton. So in this lecture we will first talk about the calvarium, and we will leave the facial skeleton for the next lecture. The skull in adults is consisted of 22 individual bones, 21 of which are immobile and united into a single unit. The 22nd bone is the only movable bone of the skull, which is the mandible, or it's called the lower jaw. So before we talk about the bones that make up the skull, let's have this question: which of the following is a bone of the brain case or of the calvarium? Is it parietal bone, zygomatic bone, maxillary bone, or lacrimal bone? We will leave the answer, so we answer after finishing this lecture. The second question is: the lambdoid suture joins the parietal bone to which of the following bones? The frontal bone, the occipital bone, the other parietal bone, or the temporal bone? So we think of these questions while we are going through this section. The cranial bones can be divided into two groups: the paired cranial bones, which are found in pairs, bilateral and symmetric, and the unpaired cranial bones. The paired cranial bones include only two pairs, which are the parietals and the temporals. The others are unpaired, including the frontal bone, the occipital bone, the sphenoid bone, and the ethmoid bone. Our skull is different of any other part of the body, since the connections between the adjacent bones is not via the joints we know. Here it's through what is called a suture. A suture is a gap, narrow gap, between adjacent bones, which is filled with dense fibrous connective tissue that connect these bones together. So it is an immobile joint between these adjacent bones of the skull. These sutures are not straight in shape. Instead, they are irregular and tightly twisting. These twisting paths or lines serve to tightly interlock the adjacent bones and adding strength to the skull for a better brain protection, which is the main function of the skull. The sutures of the skull include the coronal suture, and from the name we know that this should be running in a coronal plane, so it's running from side to side, joining the frontal bone anteriorly to the posteriorly located two parietal bones. The other suture is the sagittal suture. This is running from anterior to posterior, extending from the coronal suture to the lambdoid suture, connecting the two parietal bones to each other. The third suture is the lambdoid suture. This is named on its shape. Lambdoid is from lambda, similar to lambda, the Latin letter lambda, because it is inverted V shape, extending downward and laterally on either side of the skull, and joins the occipital bone to the right and left parietal bones and the temporal bones. There is also another suture, which is the squamous suture. This is named on the location. It's located on the lateral skull, and it unites the squamous portion of the temporal bone with the parietal bone. Another structure is the pterion. Pterion is an intersection of four bones of the calvarium, which are the frontal bone, the parietal bone, the squamous portion of temporal bone, and the greater wing of sphenoid bone. This is an H-shaped suture that unites these 4 bones together, so it's considered the weakest point of the whole skull. Here we have this figure to illustrate the locations of the bones that we have learned. This is the location of frontal bone, and this is the coronal suture, which connects the frontal bone anteriorly to the posteriorly located 2 parietal bones. These are the parietal bones. This is the temporal bone. This is a lateral view of the skull showing the the frontal bone, the coronal suture, the parietal bone, the lambdoid suture which connects the parietal bone to the occipital bone, and the temporal bone to the occipital bone. This point here is the H-shaped suture, which is called the terion. This is the weakest point since it's connecting these 4 bones together: the frontal bone, the parietal bone, the squamous portion of temporal bone, and the greater wing of sphenoid bone. This is a posterior view of our skull. Here it shows the sagittal suture, which is running from anterior to posterior, connecting the 2 parietal bones to each other. This is the lambdoid suture. As we said, it is an inverted V-shaped, connecting the parietal bones to the occipital bone and occipital bone to the temporal bone. This is an isolated temporal bone to show some specific characters and structures of this bone. So this flat portion is called the squamous portion of temporal bone. This process is the mastoid process, and this portion is the mastoid portion. This process is the styloid process, and this is the zygomatic process, which will be in connection with the zygomatic arch and zygomatic bone. This is the external acoustic meatus or external auditory canal, and this is mandibular fossa, which is a flat depression on either side of our skull that we can feel it. This is how temporal bone looks within the skull. This is the location of temporal bone on the side of the skull. This is the occipital bone here. This is its location. It has these 2 occipital condyle, which will play a role in making the the atlanto-occipital joint, which will connect the skull to the cervical spine. Another structures include the external occipital protuberance, and there is another protuberance internally called internal occipital protuberance. This is the superior knuckle line, and this is the lambdoid suture. Here, this is the location of foramen magnum, which is the largest opening of our skull base. We will talk about it shortly. Let's move on to talk about the skull base. The skull base is the floor of the cranial cavity. It's separating the brain from the structures of our neck and face. It's a bony diaphragm composed of number of bones, including from anterior to posterior, the frontal bone, the ethmoid bone, the sphenoid bone, the parietal bones, the temporal bone, and the occipital bone. This is how our skull base looks from inside. This is a superior view. It's divided into 3 fossae: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. And this is the foramen magnum, the opening of the spinal cord. Here we have a look on a lateral view to our skull and its contents. This is the brain within the cranial cavity, and these are the 3 fossae of the skull base. This is the anterior cranial fossa, which is the most anterior one and the shallowest one. Middle cranial fossa is middle, and posterior cranial fossa is the most posterior and the deepest of all. The anterior cranial fossa, as we said, it's the most anterior and the shallowest. It overlies the orbits and contains the frontal lobes of the brain. So the frontal lobes are contained within the anterior cranial fossa. The boundaries of anterior cranial fossa include the frontal bone, the lesser wings of sphenoid bone, and a portion of ethmoid bone, particularly the crista galli and the cribriform plates. We will talk about these structures in the coming slides. This is the anterior cranial fossa. This is the frontal bone, which make the anterior boundary and the inferior boundary as well. The ethmoid bone, including the crista galli and the cribriform plates on either side of the crista galli, and the lesser wing of sphenoid bone. These are the boundaries of anterior cranial fossa. So this is the anterior cranial fossa, which houses the frontal lobes of our brain. The middle cranial fossa is deeper and situated posterior to the anterior cranial fossa. It extends from the lesser wings of sphenoid bone anteriorly to the petrous bone of or petrous portion of the temporal bone posteriorly. It includes the temporal lobes of the brain, and it contains the sella turcica, which is a concavity within the sphenoid bone that houses the pituitary gland. When we talked about the pituitary gland, we talked about the sella turcica and its surrounding structures. Middle cranial fossa has several openings which provide passage for some important blood vessels and cranial nerves. Let's have a look to the middle cranial fossa. This is the location of middle cranial fossa. Its anterior boundary is by the lesser wing of sphenoid bone, and the posterior boundary is the petrous portion or the petrous ridge of temporal bone. This is the sella turcica within the middle cranial fossa, which will provide a concavity for the hypophyseal gland or the pituitary gland. These are the openings within the middle cranial fossa. We will talk about them shortly. The openings of middle cranial fossa include several openings. One of the most important ones is the optic canal. The optic canal is located on the anterior lateral corner of the sella turcica. From the name, we know that it is the passage for the optic nerve into the orbit, and it also includes the ophthalmic artery as well. Another opening is the superior orbital fissure. This is not just a simple canal, it's a fissure. It is lateral to the optic canal, and it has a lot of nerves and blood vessels that are passing through. Another opening is the foramen rotundum. Rotundum means round, so this is approximately a round shaped foramen that is located just inferior to the superior orbital fissure. It is the exit point for a major sensory nerve that supplies the cheek, nose, and upper teeth. Another oval shaped foramen is the foramen ovale, which provides passage for a major sensory nerve to the lateral head, cheek, chin, and lower teeth. Let's have a look to these openings. On the anterior lateral corner of the sella turcica is the optic canal. So optic canal is supposed to be at this location. This is foramen rotundum. This is foramen ovale. This is foramen ovale from the inferior view of the skull base. This is the opening of foramen ovale here. Other openings of middle cranial fossa including foramen spinosum. This is a tiny opening, very small, located on the posterior lateral area of the foramen ovale, and this is the entry point for middle meningeal artery, which is one of the arteries that supplies the meninges with blood. Carotid canal, this is one of the most important openings, and this is the passageway of the internal carotid artery and sympathetic plexus. This is not just a simple foramen, it is a canal within the skull base. Foramen lacerum is another opening. This is an irregular opening. Lacerum means irregular. It's located immediately inferior to the exit of the carotid canal, and by the way, this opening has nothing to pass through. It is obstructed by fibrous tissue normally. So here we have a look to what we have discussed. This is the foramen spinosum, this tiny, very small opening, which is posterior and lateral to the foramen ovale. This is the passageway for the middle meningeal artery. More posteriorly and medially is the foramen lacerum and carotid canal at this location. So from anterior to posterior we have superior orbital fissure, foramen rotundum, foramen ovale, foramen spinosum, foramen lacerum and carotid canal. And on the anterior lateral corner of the sella turcica is the optic canal. Here we have a look at these openings on the inferior view of the skull base. This is the opening of foramen ovale, as we mentioned before. This is the entrance to carotid canal. This is the foramen lacerum, and this is the foramen spinosum. Posterior cranial fossa is the most posterior and the deepest of all cranial fossae. It contains, and it is actually the deepest of the cranial cavity. It contains the cerebellum of the brain, and it is bounded anteriorly by the petrous ridges and posteriorly and inferiorly by the occipital bones. It is divided at the midline by the large foramen magnum, which is the greatest opening of the skull base. This is the opening that provides passage for the spinal cord. The openings of posterior cranial fossa include internal acoustic meatus, and from the name we can guess that this is the passageway for the vestibulocochlear nerve, right? And by the way, facial nerve is with vestibulocochlear nerve originating together and passing together through this opening. The hypoglossal canal is located at the anterior lateral margin of the foramen magnum, and from the name we can also guess that it is the opening of hypoglossal nerve, which is the cranial nerve number 12. Immediately inferior to the internal acoustic meatus is the jugular foramen. This is the exit point for inferior petrosal sinus, which is one of the veins that drains into the cavernous sinus. When we talked about the cavernous sinus, we talked about this. The cranial nerve number 9, cranial nerve number 10, and cranial nerve number 11, which are the glossopharyngeal, the vagus, and the spinal accessory nerves respectively, and jugular bulb of the jugular vein. These structures are all passing through the jugular foramen. This is the location of posterior cranial fossa. The anterior boundary is by the petrous portion of the temporal bone, and posterior by the occipital bone. The largest opening here is the foramen magnum, the passageway for the spinal cord. This is the internal acoustic meatus, the opening of facial nerve and vestibulocochlear nerve, which are the cranial nerves number 7 and 8. This is the jugular foramen, the passageway for jugular bulb and cranial nerves number 9, 10, and 11. This is the hypoglossal canal, which is anterior lateral to the foramen magnum, which is the passageway of hypoglossal nerve. Here we have a look to the inferior view of the skull base. So this is the foramen magnum, and this is the opening for jugular foramen. This is a lateral view of our skull. So let's review what we have learned about the structures of the calvarium and skull base. This is the anterior, this is the frontal bone. This is the coronal suture, parietal bone, lambdoid suture, occipital bone, temporal bone. This is the sphenoid bone, and this is the sphenoid sinus. This is sella turcica, and here this is the hypoglossal canal. This is the internal acoustic meatus. This is the ethmoid bone, including the cristagalli and cribriform plate within the anterior cranial fossa. Let's talk about some specific or important bones that contribute to the formation of skull base. Here we talk about the sphenoid bone. Sphenoid bone is considered a keystone bone because it's joining with almost all other bones of the skull. Sphenoid bone structures include the lesser wings and the greater wings. The lesser wings form the lip of the prominent ridges that marks the boundary between anterior and middle cranial fossae, as we said and as we saw on the previous slides. Hypophyseal fossa or the pituitary fossa, this is the house of pituitary gland. The greater wings of sphenoid bone, which forms the anterior floor of the middle cranial fossa. The medial and lateral pterygoid plates, which are vertically oriented bony plates that form the posterior lateral walls of the nasal cavity. This is an isolated sphenoid bone. So this is the lesser wing and this is the greater wing. At this location is the superior orbital fissure, foramen rotundum, foramen ovale, and foramen spinosum. This is the body of sphenoid. This is sella torsica or hypophyseal fossa. This is the optic canal, the opening of optic nerve. So this is a superior view of sphenoid bone. This is a posterior view if we are looking at the sphenoid bone from back. So this is the body and this is the greater wing. This small portion is the lesser wing. This is the superior orbital fissure, and these are the two medial and lateral pterygoid plates which contribute to the formation of nasal cavity. The ethmoid bone contributes to the formation of the nasal cavity as well, and it contributes to the nasal septum, the wall of the orbit, and the anterior cranial fossa. Two small and important structures of the ethmoid bone include the cristagalli and the cribriform plate. The cristagalli is a small upward bony projection that functions as an anterior attachment point for the dura mater, which is one of the meningeal layer that cover our brain. To either side of the cristagalli is the cribriform plate. The cribriform plate is a small flattened area with numerous small openings called the olfactory foramina. These openings are the passageway for small nerve branches of the olfactory nerve, which are passing from this area or this location within the skull base to the nasal cavity. This is a superior view of the ethmoid bone. So this is the cristagalli, which is the attachment of dura, and these are the ethmoid air cells. Sorry, this is an anterior view. This is the superior location and this is the inferior location. So superiorly there is this projection, which is the cristagalli, and inferiorly this is the perpendicular plate, which forms the superior portion of nasal septum. When we talk about the nasal cavity and nasal septum, we will mention this as well. Here it contributes to the wall of the orbit. This is the superior nasal concha and middle nasal concha. This is the nasal cavity. This is ethmoid bone from lateral. This is its location within the skull, and this is the nasal cavity. This is the location of cristagalli, cribriform plate, sphenoidal sinus, and these are the three nasal conchae: superior, middle, and inferior nasal conchae. We move on to talk about the paranasal sinuses. The paranasal sinuses are hollow, air-filled spaces located within certain bones of the skull. All of these paranasal sinuses are in communication with the nasal cavity, and all of them are lined by nasal mucosa. They serve to reduce bone mass, to lighten the skull, and they also add resonance to the voice. So for instance, when we have cold or flu, we feel that our voices are changing, right? Or when somebody has a flu, we feel that his voice is changing, so we can predict that he has flu. What is the cause behind this? The cause is because these paranasal sinuses are contributing to the formation of voice. They add resonance to the voice. When there is inflammation and there is fluid accumulation with these sinuses, there is increase in their mass, and increase in their function of reducing the bony mass, and in their function of resonating the voice. That's why we feel heaviness of our skull and feel that our voices are changed. This is illustration of the location of these paranasal sinuses: maxillary sinus within maxilla, frontal sinus within frontal bone, sphenoid sinus on either side of the sphenoid bone, and the ethmoid air cells. Sorry, sphenoid sinus is posteriorly at this location, posterior to the nasal cavity, and ethmoid air cells on either side of the ethmoid bone. The frontal sinus is the most anterior one, and it is located just above the eyebrows within the frontal bone. It can be divided at the midline into bilateral spaces in some population, but in some people it is fused into a single sinus space. The maxillary sinus is the largest of these paranasal sinuses. It is paired and located within the right and left maxillary bones, where they occupy the area just below the orbits. So when there is maxillary sinusitis, we feel pain under our eyes. The maxillary sinus is the most susceptible to infection because their connection to the nasal cavity is located high on their medial wall, so it's difficult to be drained. Therefore, it is more susceptible to fluid accumulation and more susceptible to infections. The sphenoid sinus is a single midline sinus. It's located within the body of sphenoid bone, just anterior and inferior to the sella turcica and posterior to the nasal cavity. This is the most posterior of the paranasal sinuses. When we talked about the skull base, we pointed to the location of paranasal sinus. The ethmoid air cells are not just a single sinus. They are several small spaces that are separated by very thin bony walls, each of which is called ethmoid air cells. They are located on the lateral aspect of the ethmoid bone between the upper nasal cavity and the medial orbit, just behind the superior nasal concha. So now let's come back to our previous questions. Which of the following is a bone of the brain case? Is it the parietal bone? Is it the zygomatic bone? Is it the maxillary bone? Or is it the lacrimal bone? We didn't talk about zygomatic, right? And we didn't talk about maxillary, except when we talk about the maxillary sinus. And we didn't talk about the lacrimal. All of these are facial skeleton. So the only right answer here is the parietal bone. The lambdoid suture joins the parietal bone to which of the following? The frontal bone, the occipital bone, the other parietal bone, or the temporal bone? We know that the suture that connects the frontal bone to the parietal bones is the coronal suture, right? And the one that connects the two parietal bones is the sagittal suture, right? That's running from anterior to posterior. And the one that is connecting the parietal bone to the temporal bone is the squamous suture. So the right answer here is the occipital bone. The lambdoid suture is connecting the parietal bones to the posteriorly located occipital bone. But we should know that lambdoid suture is also extending more posteriorly and laterally, more laterally, and they are connecting the occipital bone to the temporal bones as well. So if the temporal bone was here, the answer will also be occipital bone. This is the end of this lecture. In the next lecture, we will talk about the facial skeleton, and we will have a series of medical images, including X-rays, CT on different planes, and different MRI sequences to have a look to all the structures of our skull. Thank you, and see you in the next lecture.